Good afternoon. It is Wednesday, May the 12th, 2021. Sego, David Lahashu Juts. Welcome to today's edition of the COVID-19 Task Force Update on this, our 209th edition of Kahnawà 911. Today is going to be a very informative show. It's also going to be one you've been waiting for a few months. We have some really good news to announce for today. But before we get to the great news, we're going to start off with two guests that we have from KMHC, the COVID Testing Center. Followed by them, we'll speak to Lisa Westaway, the Executive Director of the KMHC, and Lloyd Phillips, the Commissioner of Public Safety. So we're going to kick off right now with our guests from the KMHC COVID Testing Center, and that will be Phillip Gibson. Phillip?
Good afternoon, all. Sirjirick, Phillip Gibson. I work at Kahnawà Memorial Hospital. I work at the COVID call center, mainly team leader. What I wanted to do is take this opportunity to talk about a little bit about the call center and the purpose of the call center and what we've served over this past year. One of the important things that I've learned over this past year with dealing with the call center and dealing with people in crisis is to basically come up with the basic information that is needed in order for people to be successful, and as well as all the things to run smoothly. One of the things is when you call the call center, you're basically speaking to a live person who's aware of who you are, because it would either be a person from the community or a person like myself who's been in the community for many years. So one of the things that I do appreciate about it is when you call, you actually get to speak to that person, and that person will be doing that intake. The intake process is pretty simple, but we do have a few requirements that we do ask that we want you guys to be able to carry out. So normally when you call the call center, basically once we've identified who we are and who you are and we're starting the intake process, one of the most important things is that we ask that you guys all have your Medicare card. The purpose of your Medicare card would help speed up the process. And when you speed up the process, it makes it a lot easier and faster to go through it. You know, normally when we're basically at the call center, when we're taking that information in, it is important that when you're speaking, that you're speaking clearly, especially if you have Kahnawà names and you want to make sure that we spell them correctly. The other thing is when we ask you things like a timeline when it comes down to the symptomatic checklist and say how long have you had these symptoms, please sort of backtrack a little bit on those things. Quite often what we've known and we've experienced is when people are calling, some of those things they haven't taken into factors. The other thing that we do appreciate about it, and we would like to help and serve better at the call center, is when you guys actually do call in, is that when we set up that appointment time, quite often you get a barrage of emails or text messages regarding your time. I know that it can seem like a bit of a hecticness of it, but the purpose of it is as a reminder for yourselves of your appointment time. And that's pretty important. And also as a reminder so that if you're needing to check your results, that you can check them via the email. So I do apologize in advance for the amount of text messages and emails you do receive, but it's that basically that reminder and checklist. I know that there is a function on your email format that you can turn off some of those notifications, because quite often I know when you hear them, they come in droves of 1, 2, or 3. I also want to talk a little bit about the process too when it comes into after we've done the initial paperwork. When we're doing the paperwork, after we've gathered all the information, what we normally do is the day of is that appointment time comes in the morning as a reminder of your appointment time, followed by an opportunity, or excuse me, not necessarily an opportunity, is that we end up authenticating your actual appointment. So that means that your appointment is going to be happening within an hour or so. Quite often you'll end up with a text message prior to it just indicating that we've authenticated your time. So please be aware that the time that was already given to you is the time that you'll have, but we're 9 times out of 10 authenticating your appointment prior to it. So it's better that you honor that time so that we can make sure that we can speed the process a lot faster. One of the things that I've learned over the past year in working at the call center is I'm actually quite honored to be a part of it, considering that I understand on other situations when you're outside the community and you are setting up an appointment, your appointment tends to take maybe 24 to 48 hours. Here in the community, you're fortunate that you have that opportunity that you can call first thing in the morning, and 9 times out of 10 you'll end up having your appointment time before the end of the day or before the end of the morning, which is actually a bonus to have. The other thing that I wanted to talk about is for you guys when it comes down to getting your results. Quite often when people end up getting tested in the morning, your specimens will end up going out in the early afternoon, and then at that point they would take it to a processing phase. We normally tell people that it takes up to 72 hours in order for it to be processed, but in actual reality with the new platform, it takes about 24 to 36 hours. So with that said, if you end up getting tested in the afternoon, chances are it'll be 24 hours later. So if you would wait toward the end of the following day or 36 hours, you'll be able to get your results opposed to calling in first thing in the morning and asking if you have received your results. One of the things I do appreciate too is, after being involved in this for the past year, that, we've had an amazing team, and quite often, people don't take the opportunity to thank the people behind the scenes and making sure these things happen. I know on the outside, meaning other neighboring communities, you 9 times out of 10 are doing it on the platform, on your on an app actually, whereas you guys actually get an opportunity to speak to a person to sort of guide you through it. So with that said and done, I wanted just to thank you guys very much for allowing us to be there, and if you ever need an appointment, make sure you give us a call. Thank you.
Thank you very much, Philip. Up next is Don Lazare. Don?
First, today's May 12th. I'd like to take an opportunity to wish all my fellow nurses a happy Nurses Day, all the ones past, present, and future. So Phillip was talking about the inside operations of the COVID test center. I work in the tent in doing the actual testing. We've been doing this for close to a year, and we've had quite a few staff come and go in the test center. We had staff come from home care nursing. There was Sonia and Oliver. From inpatient department, there was Rebecca and Samantha. We've had other KMHC staff pulled in, the dental hygienists, Susie and Elise. As well, in the test center itself, there's been Dale, who's been there basically the whole while. Philip, myself, Susie has been there too. We've had Tasha, Kayla, Nikki, and we've had, I'll say loners come from MCK. We've had Talia, who I think she's an employee of KMHC, Vanessa, Andrea, and now we have Lorraine. We've had a lot of security come through, a lot of the bus drivers who were reassigned, and there's Sean, Dwayne, Travis, and if I forgot anybody, I apologize. But when you pull up into the test center, you're greeted by the security first, and they'll ask if you have an appointment, and they'll ask your name, and then you pull up into the COVID tent, the testing tent, and we'll verify your information, your birth date, your phone number, your date of birth, your email address, and we ask that you sanitize your hands, blow your nose, and sanitize your hands again. We've been quite busy, especially now, because people who work in health establishments and are not vaccinated, they're required to have 3 tests a week. So we are pretty busy. There's just a handful of people who are not vaccinated, but what I ask is that to be kind. We get some people who are less than pleasant, and we do our utmost to be pleasant to everybody, and we're the workers, we don't make the rules, we're just doing our jobs, and I just ask that people be kind, and that's it.
Don. Up next is Lisa Westaway, the Executive Director of the KMHC, and she's here to bring you some new information and some relatively very good news. Lisa?
Thank you. I too would like to acknowledge Nurses Week and just say a thank you to all the nurses, all the staff really, but this week in particular, all the nurses who really have devoted the last year of their life to helping improve the safety of the community. So thank you for that. We do have some good news to present today. So we have been doing analysis, as you know, for quite some time. We've been looking at vaccination rates in all of Quebec, especially in the Montérégie and Montreal area, which has significantly increased. We've also evaluating that all of our essential service workers, mostly our frontline workers from KMHC, KSCS, KFB and the PKs will have received their second dose of COVID-19 vaccine by the end of this week. We know that Kahnawake is 74% vaccinated, 16 plus, and we are in the preparations for second doses for all of community. In an effort also to respond to mental health needs for the community as a whole, to increase empowerment, freedom of choice, freedom to make one's own decisions, release people from isolation little by little. This is really important, and we've been focusing on this for some time with existing measures that are in place. All of that being said, we feel that we're in a position where we're able to move from a red alert level to an orange alert level. So this is a big change. It's positive. Although we have had measures in the orange alert level for a little bit of time, we are really happy to announce that we'll be making some more changes or easing of measures within this orange alert level over the coming weeks. One thing that I still want to talk about before Lloyd presents those changes is the fact that COVID still exists. So yes, we are in a safer place, and we feel comfortable and confident that we all have the knowledge that this past year has provided us with knowledge, education, the ability to to do a risk assessment for ourselves and for our families about which activities we want to participate in and how we want to live our day-to-day life based on the level of risk that we're comfortable with. So we still do have risk because COVID still exists, and in fact with the upcoming changes we expect that COVID cases will increase within the community. And we are preparing for that right now so that we can ensure to identify, contain, and limit the transmission of these COVID cases within the community very quickly, as we had done with the recent outbreaks that we had. And that was a really good demonstration of our ability to contain COVID within the community quickly. And it's because we have great people working in the community and a community that follows the isolation measures that we put in place that we're able to do that, and that we feel confident in moving forward with these measures. So again, remember, it is our individual responsibility to assess the situations that we put ourselves in, to decrease risk as much as possible despite reopening measures, to continue with hygiene measures, distance, washing our hands, masking, cleaning surfaces, vaccination, thinking about each other and our safety and our mental health and well-being on a day-to-day basis, super important. So we do have that personal responsibility, but with that, I'm going to let Lloyd present the changes that will be coming into place with this orange alert level. Thank you.
Thank you very much, Lisa. Yeah, it has been certainly a busy week here at the task force, doing a lot of assessments and trying to come up with some, I guess, some concrete decisions and setting the stage moving forward. You know, and as we said many times, these assessments are ongoing, and there's no definite starting point nor ending point, but it's an ongoing process. And as Lisa mentioned, we feel confident now in order to take those next steps, and a significant one in moving back effective May 21st, which is next Friday, moving officially into the orange, as well as we are going to look at making some modifications to some of the existing directives that directly impact individuals as well as certain businesses. Keeping in mind, this is going to be a phased-in approach within the Orange. That the first initial phases may seem small to some people and may seem very large to others. But we feel that it's a step that will set the path moving forward to allow for more personal freedoms and allow for at least the first stages of businesses who are currently closed to reopen their doors. So I'm not going to go through all the details today because we will be releasing more information tomorrow, as well as have another Facebook Live tomorrow to go over some more details, as well as we will have people reaching out directly to the business establishments who are impacted to give more clarification and also start that process moving forward. So effective May 21st, organized sports and recreation will be allowed to resume. For example, like softball games and such will be permissible, maximum 12 person on any given field at one time. There is going to be subsequent masking requirements and obviously distancing when people are not playing. And there is a lot of details that will be released in terms of them having their league or their game follow according to the proper standards, and we'll get more information on that. Gatherings again as of the 21st of May. Currently, we are allowed 8 people outdoors. We will be increasing that to 12 people. So effective next Friday, the 21st, 12 people gathering safely outdoors will be something that is permissible. However, at this time, the one household indoors gathering is still going to be in effect for the next little while. We don't want to roll out too many measures at one time and have too much potential impact. So we want to take it slow. We want to be careful so that one household visitation at a time is still in effect. Keeping in mind organized sports of this sort, as well as gatherings of 8 people or soon to be 12 in Kahnawake and household visitation, it's a direct result of the large turnout of people being vaccinated within the community, the compliance of directives by the vast majority of the community, and it's well ahead of the schedule that's happening outside the territory. So these are some positive developments that we can collectively celebrate because we're able to take these steps forward as a community. As well, churches and ceremonial services that will increase to a maximum of 25% capacity in the building with a maximum of 50 people. Again, more details to follow on that. But one of the larger ones, again, in relating to businesses is restaurants. Again, effective May 21st, restaurants will be allowed to reopen with 25% capacity for indoor dining, as well as they could open their outdoor terraces, ensuring that distancing measures and safety measures are in place. There are going to be many, again, details to follow on with each industry to ensure that we have the utmost safety while allowing these things to happen within our community. So more information to follow. But as a first step, opening of restaurants in the community, 25%, as well as the terraces, is going to be for Kahnawake Rono only, or those people who are working directly within the community. And this will be assessed as things go along. Bar areas, if somebody has a bar/restaurant, the bar areas are to remain closed during this first step. Alcohol beverages could be served, but have to be accompanied by a meal. So again, positive developments. It's a step in the direction of returning back to normality, and it's, I know some people may think it's a small step, but we believe that it's a safe step, even though it may be viewed as small. With that said, we have one final part, is the cigar lounges. They do have outdoor terraces. Will also be able to be permitted to open again, it's open to locals only, and as well as distancing measures are obviously going to be in effect as well. So these are the initial decisions that were made in order to take the steps to phase in reopening, phase in the way of back to normal. There is no clear answers for the multiple questions that we get and the multiple types of businesses that exist within our community and the various versions of those businesses. So it may not capture everything with one swipe of the pen, so to speak, but we're doing our best to find a balance between the safety of our community, ensuring that we allow more freedoms, we have more activities available for our community, but also being safe. Because being safe has been the key, has been what we've been here for as a task force since the beginning. And even though we're doing things safely, we're doing things slowly, as Lisa mentioned, there is still a level of risk. And again, it's up to you as an individual, if you want to partake in any of this type of activities. If you don't feel safe having additional people in your home, if you don't feel safe, going to a restaurant or a terrace, that is certainly your prerogative, and nobody's going to criticize you for that, or it's everybody's has their own level of risk they're willing to take. So again, it's a step to take, as well as considering the mental health aspects of our community. We believe that people having the ability to socialize a little bit more, have recreation more, enjoy a dinner, is also helped ease the pressure, anxiety on individuals, and help ease some of the mental health issues that we've been facing in the community. So with all that said, more information will be forthcoming. I didn't want to get into all the details today, but I just wanted to make sure the community is well aware that we're taking this step. Now it's time to prepare for the next phase of the pandemic. And if we continue to be vigilant, we continue to follow the rules, we can take to step one, and then soon we could look at step 2 and step 3 and continue down that path to normalcy. Kahnawà.
Thank you very much, Lloyd. Thank you very much, Lisa. Definitely some great news for the community and something to look forward to next week. And don't forget, we'll be live again tomorrow around the same time. So don't forget to join us. From all of us here, thank you very much for joining us. We'll see you again tomorrow. Kahnawà, Danu, Onerahtohkó.